Good morning, everyone, and welcome to our Return to Childcare What to Expect webinar. It's exciting to see how many people are logging on this morning. I'm sure a lot of you are parents that are joining us today to get your questions and concerns answered about taking your or bringing your children back to some type of childcare in the next couple weeks, couple months. And so it's exciting to see all of you logging on today. We have a great panel of pediatricians and childcare providers that we are going to hear from. First, I want to introduce at least who's hosting this webinar. It is the Early Childhood Investment Corporation, the Michigan Women's Commission, and Zero to Thrive Michigan Medicine. I am Alicia Maneely. I'm going to be your moderator today. I am a commissioner on the Michigan Women's Commission. I am also the Governmental and Community Affairs Director for the Michigan Child Protection Registry. But most importantly for today, I am also a mom. I have a son that is 11 and a daughter that is in the seventh grade, or is 7 years old. She thinks she's in the seventh grade. But they are no longer in daycare anymore, but my son was for a total of 8 years. So I know exactly what you are all going through right now. The reason that we're all here today is because last fall, the Michigan Women's Commission, we developed and sent out a survey to parents all across the state of Michigan, and we received a phenomenal response from hundreds of parents. The survey was asking parents what they were currently doing with their childcare options. So many of them had to quickly leave the office, come home, childcare centers were closed. So we wanted to know how they were doing during the pandemic and what their plans were going to be in the future if and when things were to start back to normal. If any of you that are on today have not seen the survey and you want to see what questions we were asked, what we asked and our results, you can go to michigan.gov/MWC. I believe that we're going to put that right in the chat box in case you didn't get that. So during the time of the survey last fall, it was, parents were at home taking care of their children, also trying to work and also trying to teach their children. And so parents obviously had a lot of questions. It was a very stressful time. One of the questions we did ask them, though, is what would you want to do once things started to slowly get back to normal? Would you want to keep your kids at home? Would you want friends or family to be watching them? Where would you like your kids to go? And the response that we got was that most parents did want their children to return to a childcare center or home, but somewhere that was definitely licensed. So now, fast forward to today, Michigan is doing a great job with our vaccinations. Most, if not all, of our K-12 students are back in their seats at school. So employers now are starting to slowly bring back employees or figure out how to bring back their employees safely. So parents now need to start thinking about childcare in the next couple weeks and months. And so even though parents want to do that, they also have a ton of questions about safety and how this is going to work, what it's going to look like. So that's why we're here today, and I'm going to introduce our panel. They are going to be the ones answering all your questions and hopefully helping you out with your concerns. When I call your name, if you could just do a wave so our participants know who you are. We have Dr. Andy with Michigan Medicine, Department of Pediatric Emergency Medicine. Dr. Sharon Swindle, an academic general pediatrician and child health advocate. Monique Snyder, Director of Brainiacs Clubhouse Child Development Center. And Angelique Lopez, validator at the Early Childhood Investment Corporation and a former child care provider. How we're going to start out today is we have a set of questions that we are going to ask our panelists. But I'm sure there are going to be things that we have not asked in the first half hour, 45 minutes. So please, in the chat box, if you have a question that we have not answered, please put that in the chat box. And then towards the end, we will answer as many of those as we can. So we are going to get started. My first question is for Dr. Swindle and Dr. Andy. Why do you feel parents can confidently and immediately transition back to licensed childcare, whether that's home or center?
Alicia, I'll take that question to start with, if you're okay with that. I think the answer to that is because we have a lot more data and a lot more experience over the past year. As you know, it's been over a year since we've had the pandemic officially in the United States. And since that time, it's been pretty clear we understand a few things. One is that although kids do get COVID and they can spread COVID, that the rates are actually really low in childcare. And we know what works and what doesn't work. We know that masking is really effective. We know that screening is very effective. And so over the course of the year, we've seen in different states with different regulation what works and what doesn't work. And so in the state of Michigan, early on, although many childcare providers chose to kind of take a hiatus or were closed, as things opened up, because childcare is such an important part of society with working parents, they've really been successful at keeping rates of COVID very low, using a lot of these mitigation strategies effectively. And so, based on kind of the information we know, the mitigation strategies that have been successful, I think parents can be very confident that they're going to be sending their children back to a very safe environment. I also want to point out that, we think about childcare, but it's also, so much more than just keeping kids safe. It's also, we think about education and the stimulation and the growth and the development that comes along with that. So I really think that, the benefits way outweigh the risks here. Kids need a stimulating environment. They need that education. They need that development. And childcare is a very, very important part of that. And so that's why, the sooner we can get children back to that, parents back at work, I think that's going to be really important. And I think we can do that right away.
Yes, and I will just add to Dr. Andy's comments and say, agreed that, childcare facilities have understood how to adapt the standard operational procedures. And I think we'll be talking more about that, so that what was already a safe environment is even safer. When you look at young children, they're lower risk of getting or transmitting COVID. And then we have to talk about the game changer, which is the vaccine that's available to adults. So if you've been a household that might have had a vulnerable adult in the household, you now have this opportunity to protect that person with a vaccine, as well as the child care providers. And so that really adds a huge layer of safety to a child care setting as well.
Great, thank you. So my next question is going to go to Monique at the Brainiacs Clubhouse. What should we expect from our licensed childcare providers?
Well, good morning, everyone. And I'd like to first start off by acknowledging the fact that we have collaborated on this platform. So, in regards to expectations, parents, take a look at who is advocating for our industry and our children. We have top of the line, most experienced physicians on board. We have experienced educators on board in regards to Angelique, and we are only representatives of an industry. So just imagine all of us coming together to make sure that this combat, if you will, against the COVID is 100% moving forward, full throttle. I always caution parents that we have always followed high safety standards, regardless to pandemics or not. But this pandemic came, and one of the things that I looked at when we had to return was, when you get lemons, you make lemonade. And that's exactly what we did. We turned that social distancing into the sweetest situation. Our parents can now curbside or door to door pick up and drop off, where it's exclusive. And with us looking at it in a different direction, not only have we adhered to the state mandates and the precautions to prevent spreading, but the children feel more pride, they feel more important. My teacher comes to my car, and the parents can sign them in mobilely. We prevent the social clutters when you're picking up and dropping off that way. So the social distancing is adhered to. Some of the other things that parents should expect is fun, just fun. The same thing we've always had: academic success, high quality. Even while everyone was at home or working and Zooming, we were on spot. We were working daily with our staff to make sure that our day-to-day operations did not affect or um, increase the spread. So let me give you some examples with our academic settings. We operate off of the high scope curriculum. So in our small groups, what we do now is we distance and we use different sounds and things to communicate. The children are the most supportive and what is the term I'm looking for? Flexible. They help us more than we know. We're more so the lemons, you know. It's our fear, and the students are like, hey, just put your mask on, Miss Monique, let's keep going. And that's exactly how we do it. So with your expectations, don't expect anything less, expect more, especially with the team and the collaborations that we have through the state of Michigan right now. You all, especially in the early childhood education sector, we are 100% attacking COVID and every other um, hindrance that has come as a part of that. So we're ready. We're ready.
It sounds like it. Yeah, it sounds like you're on it. That's great. Okay, we're going to move on to the next question. This one's going to be for Angelique. At the Early Childhood Investment Corporation, we know that ECIC has a number of resources to help parents with childcare, but in particular, how can parents find out which licensed childcare providers are currently open?
Good morning. Yes. So greatstarttoquality.org. I just want to throw that out there because that is the main form or resource for parents right now. You can go on there and find information on all the child cares that are open right now. And we have found that over 80% of the child care providers are open and ready to receive a call and for you to enroll your children. So another number that is helpful that you can reach, it's statewide, and it will connect you to your local resources. And that's the phone number for Great Start to Quality, and that's at 877-614-7328. But yes, all what we have found out is that childcare providers, when we took the survey, they've made the changes that they've needed to, and they are ready and eager to hear from families. Greatstarttoquality.org also has a section that you can click on under families, and it's called Child Care During COVID-19. And there you can find lots of resources about not only finding childcare, but things you can do to prepare your child and your family for returning to childcare. On greatstarttoquality.org, you can search for childcare by type. If you're looking for a group home or a family home or a center, depending on your family's needs, you can search by region. You can search by the hours that you need care. So it's really easy and intuitive, and you can, as soon as you click on it, you can see the child care providers that are open first, and then it will also list them by rating. So that's really something some parents and families want to look into as well. So yeah, greatstarttoquality.org.
Great, thank you. That's a lot of information. So if some of you aren't, being able to quickly write down some of these websites, go to the chat. We are, making sure that all this important information is in the chat box. Also, I just wanted to remind all of you, if you do have a question and, we questions that I am not asking, please put your question in the chat box, and towards the end, we will get to as many of those as possible. We're going to move on to the next question. How can a lot of these parents, I'm sure, they're worried about their children have been home for the last year, and now they need to prepare them and somehow get them to adapt to go back to a child care center. It's going to be very different. How do parents prepare their children for that? It's open to anyone.
Well, I can start with some ideas. I think partly will depend on the age of the child and whether they have previously been in a childcare setting that they're returning to. So if it's more of a toddler age child that is returning to a childcare setting, I think it will be important to prepare that child for how it might be different from when they were previously there. So if there are new providers or protocols, which there would likely be, to give them an idea of this is what we do when we come in. These are some of the things that you will see. If your child's been inside and home a lot and not wearing a mask, then I think practicing mask wearing and having fun masks to wear and think about and make games and put on stuffed animals, but modeling some of the behavior that will be expected there, talking a lot about routines, things like that will be very helpful for a child in terms of the transition.
Anybody else with any insights?
A few other things. I think what's been highly demonstrated, as I think Monique has mentioned, that kids are highly adaptable, highly flexible, and they really look to kind of parents, as role models and support. So I think, in addition to the masks, I see a lot of kids in the emergency department, and they are all, above 2 are easily able to wear the mask. They see it as a part of their outfit. I've seen lots of different, from Marvel heroes to different cartoon characters. They love their masks. So if you make it fun, and I think if you make it part of their kind of outfit, and if you are able to role model, that's going to be great. Another thing that is helpful is, hand washing is not a something you're born with. It's a learned activity. So I think really taking some time to kind of show your kids and kind of reinforce what good hand washing is, and how you can kind of sing your ABCs as you hand wash. It's an important skill that you can learn even before you start childcare. So those are kind of important things that I think, but the kids have done well. I know I have a lot of colleagues and, frontline workers that had kids go back to childcare because they needed to, and they've transitioned really nicely. And, mask wearing is just a part of everyday childcare and school for them. And so they've done really well.
Yeah, I also like to chime in regards to the return. So for us, what we see, and like Dr. Andy said, the children are resilient. They bounce back and they're better than us. If when you bring your child, I ask that you do the social emotional development for you as well, parents. Prioritize yourself and how you feel, because your energy is shared with that baby. And if you're scared, then they're going to be scared, and it's a trickling effect. So once you say, I have to do this, and this is where we're going, do the simple exercises in regards to like ABCs while you're washing your hands. And note this too, a lot of the protocols that we picked up since COVID are things that parents tell their children not to do. Don't play in the water, turn it off. You've been washing your hands too long. Now we embrace it. We have multiple portable sinks where children will say, I need to wash my hands. So they've adapted so easily. So for the parents in this transition and coming back after COVID, in my experience, the parents probably, as Dr. Sharon Swindle said, model the behavior, model it, enjoy it, and embrace it, because it's really everything we've done just multiplied or, magnified. So for the parents who are returning, let's just ensure that our energy, you know, um, we're positive and redirecting the children, and we're letting them know this is a safe environment. Masks are fun. Water is fun. Wash your hands.
That's great. I know it is. You guys keep talking about how the kids are so resilient. It's so true. My daughter comes home with her mask still on, and she'll just keep wearing it, 15, 20 minutes after she's been home. And I have to remind her, you can take that off it here if you want. And my daughter loves it. It's become kind of like a comfort thing to her, I think. My son, not so much, but yeah, she loves it. It's almost like a blanket or something to her. Okay, we have one more question that we've come up with for our panelists. So please, if you are a parent out there, and again, we have not answered a question that you really want answered, please put it in the chat box. So the last question I have for you is, what would you say, and anyone can answer this, please. If to those parents that have never put their child in daycare before, maybe it's their first child, or they just now have decided in the next couple of weeks, next couple of months, it's time for their children to do this. What kind of red flags should they be looking for? What should they be asking these daycare providers? What should they be in the know of before deciding which center or home to put their children in?
I can respond to that as far as new parents, right? New parents.
Yep.
Um, you would approach it as if you were going to any other scenario. If it were going to be a cousin, parent, neighbor, just responsibly. Let's start there. Look at what you need, look at what your needs are, and look at what your child needs. And then you choose a facility based on that. Every facility is not the same. Some facilities are focused on different missions. So I would always caution parents to do your research first. We all are operating under a standard licensing procedure. So I don't want parents to have the perception that this center does one thing and this center does another. We have standard licensing procedures, but because you're a first time parent, you want to make sure that you're asking the hard questions. What are your safety protocols? Especially for infants and toddlers. How does your staff interact, especially with a mask on? How are you nurturing and still academically assisting my child, making sure they're meeting developmental milestones? So those are questions that I would ask as a parent. And as a provider, I would definitely let them know that every child is different and unique. So in order for us to effectively develop and get to know the family, we have to keep the lines of communication open with the parent, with the staff, and especially with the child. So if something is going on at home, let us know so that we can attack it accordingly. If the child changes formula, let us know. Simple little things that already exist, but we're kind of magnifying them, if you will. And don't walk into the situation afraid. I don't want to say afraid. Well, yeah, afraid. Whenever you're doing something new, it's always going to present that little tingle in your tummy. But just go with your gut. Your gut feeling will tell you if this is for you or not.
Good answer. Okay, we do have a question, kind of a question from a panelist. Is advice different depending on the age of the child that you are giving parents? So for example, should we be thinking specifically about, when we're talking about infants and we're talking about 3-year-olds and we're talking about 8-year-olds, are there different, is there different advice or different things that you were doing within the classroom for those different age groups?
Absolutely. Absolutely. It's mandatory. Again, every child is different. So you can't treat a toddler the way that you would treat a school-age child because they're two different developmental milestones. Right now, 0 to 2 doesn't wear masks. So we have to do additional protocols in order to make sure we're being, safe. So it absolutely makes a difference on the child age and where they are developmentally. Don't just consider age. You know, some children are advanced at 5 and they can communicate and socialize. Other children are not. So these are things that we take into heed when we place the children, so that we're meeting their needs and we're not diminishing their self-esteem. You know, we want to make sure that we are approaching all of their needs immediately, in addition to meeting the COVID safety standards.
What, this morning all over the news, they were talking about 3 feet versus 6 feet. What do you have to say in regards to that?
Based on the information that I have so far, I I can't say yay or nay because it is new. But I also know that working in an infant toddler classroom, and I'm going to use this classroom because it's the most prominent where they do remove the mask, because we've downsized our numbers so much, it works. It works. So in that classroom where we had 1 to 4, 1 provider for every 4 children, now we were able to, with the state of Michigan and its collaborative, we could take it down from 1 provider to 2 children. So now that risk is a lot lower because they were having a hard time wearing the mask. They're just really little, like 1-year-olds, just they're like, yeah, I don't want it. But for the older children, they were a lot more adhering to the mask. And like Dr. Andy said, they put superheroes on them and wear them with their outfits. So it was easier. But yeah, in regards to the little people, definitely.
Yeah, and just to piggyback off of you, Monique, also with the younger ones, 0 to 2, they developmentally, they do what's called parallel play. So they naturally tend to kind of play, maybe near another child, but not too close anyways. They're kind of doing their own thing. So it's not difficult for them either to kind of keep their distance from each other. So they kind of might watch another child over there do something and they're doing something else over here. So that is also, I think, plays a role in all of this.
So I think I'm going to go back to an earlier question before I move on. In terms of overall COVID itself, younger infants, especially under the year 1, are definitely at slightly more increased risk for COVID. But that's why I think it's important, that relates to the other question. When you're talking to your childcare provider, I think it's okay to ask as a parent, what do you do when you have a case? What are your protocols? What proportion of childcare providers are getting immunized? How often do you clean? Do you work with the county health department? And so answering those questions, I think, are really important and can help parents know what's going on, make sure there's transparency, the communication is good between all players, and what kind of screening goes on. And I think it's also up to parents as well to kind of screen their own children if they feel their children are ill or are not feeling well. It takes, a community, right? And so we found that during this pandemic, both parents, providers, pediatricians have really worked together to kind of maintain a safe environment, because we know how important childcare is. So I think, yeah, the risk is a little bit higher in younger children. But again, I'm going to share this graphic that I have from the CDC here, but shows you that, although kids for cases and hospitalizations, especially for hospitalization, might be a little bit higher compared to 5 to 17-year-olds, if you look at the risk to adults, it's much, much higher, especially the older you go. So, and you're talking about if you're 40 to 49, 15 to 25 to 35 times. So the risk overall for kids is actually is low. And it's important to remember that. And again, we're talking about benefit versus risk, and the benefit of having your child in a stimulating, caring environment is important. We need to have parents back at work because many families dependent on that income. And so I think moving forward, I do feel it's a very safe environment. The risk is low, but it's also fair to ask your childcare center, your family provider, what is being done so that you feel confident and making sure that your child care center is safe to attend.
Yeah, and I'll just add, we're making a lot of statements that are kind of overarching, but obviously each family's unit is its own unit. And so there might be specific things in your family that need further consideration. If there's a chronic health condition in the child or in a family member. And so the other thing I would urge people to do is to talk to your own pediatrician or child health provider about your family and any particular things that you should be looking out for. But overall, it's important to remember that children in general are a minority of COVID cases and are very rarely hospitalized with serious disease, no matter what the age, relative to the adult population. And really, the younger children have been shown not to transmit the virus as easily as teenagers or adults.
Okay. So I have one of our participants has had a specific situation with her 3-year-old who was experiencing cold-like symptoms, had a fever. The daycare center wasn't big on the child getting a COVID test. The parents did anyways. The child came back COVID positive. What she's asking is, I remember when my kids went to daycare, if they had a fever, they could not return, within 24 hours. So now what is the policy if a child comes in with a cold, a fever? What are parents what are they being asked to do because of that?
Okay, for us, what we do is immediately quarantine or isolate the child away from the other staff members and students. And then we communicate with the parent in regards to what is going on. We have to ask the hard questions. Some of our children have pre-existing situations, so we don't want to just say your kid has COVID and, ridicule them. Once we figure that out, then we say the next steps are, if the parent is like, I don't know, we say, you need to schedule an appointment right now. Let's see your appointment time and date with your pediatrician so that we can ensure that this child is safe. That's our priority, the safety of the child. So we immediately have them either on site or call us and let us know how soon before this child can be seen. And if it's over 48 hours, we ask them to take them to the emergency room if they have a temperature. We do request that. And like I said, every case is specific and different because every child comes with their own, beautiful little setup, if you will. Like my daughter is asthmatic and she's been runny eyes, runny nose, and I know what it is. I take the temperatures. We've been tested. So when she's out, I have to remind her, take your Benadryl and this is what it is. And it helps us to communicate. That's the biggest piece for us in childcare settings. Tell us the truth. There's no judgment, but if we can't have a clear, transparent line of communication, then that's when we go to the extreme and say the child cannot return without clearance from a certified pediatrician or physician. And we don't want to isolate families because we are an extension of their family. And we want to make sure that whatever they're going through, we're helping them along the way. So just to recap, each child is different. We ask the hard questions. In the event that it's something that the parent has not previously disclosed to us, we immediately remove the child from the school, especially with the temperature. You cannot stay with a temperature at all. We immediately remove the child or have them placed in safe care with a family member or the parent, and we request signature information from physicians. And we've had multiple colds, runny noses. We have children with asthma, and all of our parents have been so helpful and open and transparent in this process. Thanking God, I operate 2 facilities, and we have not seen one COVID case in either. Thank you so much. We worked so hard. Because of that, we communicate with our parents at 11 o'clock at night to, do you have a cold? talk to me, you know, tell me what's going on so that we know what's going on. And that helps. That's huge. So again, our parents are extremely communicating well. They're transparent, and they bring in they bring in a notice from the doctors. The other thing is, let me say this, ECIC, Hope Starts Here, has given us resources for parents who are even struggling with medical assistance and they can't get coverage. We know where to send them immediately to our local health departments to get tested, or to even just have the child reviewed. So this network, again, I can't emphasize that enough. The network with our health departments, our industry advocates have been overwhelmingly supportive in this situation. So communication, transparency, that's key.
Thank you. Anyone else? All right, if not, we're going to move on to kind of a different subject, vaccines. I have a parent that wants to know, in terms of vaccines, what are childcare professionals being asked to do? Are your centers asking I know that you can't mandate something like that, I don't think, but what is happening with the teachers in daycare centers in terms of vaccines?
I can speak in regards to our facilities. Our staff is 100% on board. We all have families. We all are working under, if you will, frontline situations. So no one skipped a beat on that. But again, like you said, we can't mandate. I don't know what it looks like in the future, but right now, all of my staff is 100% on board. This is my schedule when I go. This is my second one. We have one who had to sit out because their arm wouldn't move, but she's fine. And that's awesome. As long as we are all working together, it's a well-oiled machine.
Yeah, I was just wanted to add that vaccines are available for childcare providers. So if you are looking to enroll your child with a childcare, I do think that's a fair question in these times. I know usually we're kind of like hesitant about asking medical questions to people because that is private, but I was a childcare provider and I definitely would have volunteered that information because that is something that is important in this time. And also for, yeah, I think it's just helpful to know that all childcare providers are available for that vaccine, and that might be something you want to bring up before enrolling your child.
Yeah, I think as I speak from, in the state of Michigan, I know it's a high priority, right? We realize how essential childcare providers are for everybody, and how important it is for the development of the child. And so if you look at the state of Michigan, what they've done is they've put childcare providers and teachers high up there in terms of the priority. And I know Dr. Swindell and I have met with childcare providers, and we've gone over webinars, seminars, and I do with my local childcare centers I work with, how important the vaccine really is for their own personal protection. We know COVID is a lot more severe in older folks, right? And so protecting them is utmost importance. It also makes business sense too, right? And so if you can offer protection, because there's some evidence that shows that if you've had the vaccine, you may be less likely to transmit the virus as well. So I think it's a high priority. Michigan has placed a high priority on making sure childcare providers get vaccinated. There are definitely some states that they were not prioritized at all. So I feel we've done a really good job in the state, and I encourage whenever I meet with childcare center providers, family providers, that vaccination is going to be a game changer in terms of how we approach and kind of get over this pandemic.
Yes, and I would just add that Dr. Andy and I practice what we preach. We were definitely in line for our vaccines when we became eligible. And, we're really trying, it's obviously a personal choice. There is clearly questions and hesitancy among many people. And we're really trying to do our best to make sure that people have credible information about the vaccines, because we feel they are safe and highly effective, and really are going to be our opportunity not only to save lives, but to get through this pandemic. And from that childcare perspective, having providers that are protected, again, having adults in your home that are protected, particularly those that are more vulnerable, is going to be just a really, really important piece of the puzzle. Children eventually will likely become eligible for COVID vaccination, but that's still months and months away, most likely. But while we're talking about vaccines, I also have to say what you can do to protect your child is make sure that they're up to date on their routine childhood vaccines. As kids stayed home, and understandably, families were reluctant to take them out anywhere, including their own doctors, particularly at the beginning of the pandemic, we saw vaccination rates for routine childhood vaccines really plummet. And though they are coming back, we're still not where we should be to adequately protect the community from whooping cough and measles and those kinds of things. So let's not forget about the routine childhood vaccines. Pediatricians really want families to get back for them if their child is a little bit delayed.
Thank you, Dr. Swindle. That's something I haven't heard of. So that's interesting.
One of the things that Dr. Swindle brought up was the vaccination for parents, new and pre-existing, who are coming back. We mandate that your child is up to date on immunizations, especially under the current circumstances. And unfortunately, we have had to turn away some families who decided against it. However, I want to make it very clear, everyone has their own choice. Under these trying times and very unfortunate circumstances, we will not enroll any child who is not completely vaccinated through the state of Michigan. So that is something that all parents need to know. I know that probably 90% of the schools that I interact with has the same protocol. I don't know that it's 100% across the board, but they should be prepared for that if they've chosen not to vaccinate.
Okay, another question. A parent is asking if a parent feels that their child care center is not doing enough or not following the CDC guidelines, what do you tell them they should do if they want to report something? Where do they go?
First, I would say go to your center director. You know, don't ever keep things to yourself. If you see something that needs to be addressed, definitely open your mouth and have that conversation. We're all human and we're all learning this as we go along, you know. Second of all, I'm not sure that any facility can operate under a license and not meet the guidelines. In the event that they're not meeting those guidelines, you can state report. And when you state report under that, you have to look at it as, I'm not hurting, I'm assisting in the process. So first you communicate with your center. Hey, I'm noticing this. What do you have in place? Can this be changed or fixed? And if you're not getting the answers that obviously licensed providers should be adherent to, then you need to make the proper decision and say either remove your child or, you know, have a conversation with licensing and say this is mandatory for the safety of people. While I don't foresee that, well, I haven't seen it, and I apologize, and my heart goes out to the individual who has experienced it. I would highly recommend that they go to the administrative team and have the conversation. And then if it's not handled at that point, you can definitely, I mean, you can report to the health department, and it's for the safety of your child and every other child. So it's just safety.
Thank you. Okay, a lot of questions are being asked about next school year. You know, a lot of parents, I have actually a really good friend that is where her company is saying, you know, we want the employees to go back after summer, because I think there's a lot of employees that have gotten really used to working from home, and now it's summer and now you're going to ask me to come back to work, and they're like, yeah, no. So parents that are looking towards next school year for school districts and for childcare centers, now that there are lower class sizes and there's low child to adult ratios, what should districts and centers be thinking of in regards to staff, budgeting, all of that? Will it still look like it does now, or should they be thinking that we're going to be a little bit more back to normal so you can start hiring more staff back?
Well, that's a tough question. There's so much we don't know yet. I tend to be an optimistic person, so I'm hopeful that I think it's going to take a take a village approach, right? So we really need people to continue practicing masking and physical distancing. I think vaccinations are going to be really important. I think the decreasing the distance from 6 foot to 3 foot will logistically allow more students in a classroom. 6 feet is really tough with desks, right? And so this allows logistically more folks to be able to attend schools, preschools. And so, do I hope that we're going to be a little bit more normal next year? I'm very hopeful, but again, it takes a village, right? And so all of us have to contribute to this cause. So there are a lot of factors that we can't account for. So yeah, am I hopeful? Yes, but I think we need to continue to not let our guard down. Continue to kind of move forward with what we know works. I mean, if you look at the influenza rates, RSV rates, all these different viruses, they're almost zero this year, and that goes to show how effective hand washing, physical distancing, masking is, and it also shows how infectious COVID is, right? And so if we continue to kind of work together, support each other, I'm hopeful that we can slowly start to return to normal. Now, will there be more protocols? Will we have to continue to have bubbles and cohort? Probably. It's not going to magically go away. Will we have to think about booster vaccines? Maybe. We just don't know that yet. But I think based on the data that we have, if we continue to work together, I'm very hopeful.
Yeah, and I'll just add, I think one thing that's really come out over the course of this pandemic is the toll that it has taken on families and kids who have not been in school in particular. So I'm not sure having open schools was the initial priority. And I think it's definitely taken more of a front seat as we've recognized the not only the learning loss in all virtual environments and some of the equities around access to education in those environments, but also just the stress on the students, the kids, and the families trying to juggle work, be a teacher for your child in a virtual environment, and helping the children deal with the isolation from peers and socialization that's so important for their development. So I'm hoping that the protocols in schools, the reduced distancing where more children can be in a classroom, the protocols in the childcare facilities are going to allow families to feel more comfortable about having their children in those settings, reducing the stress in the household, which is healthier for everyone.
Yeah, and I also wanted to add that just normalizing staying home when you are unwell or your child is unwell or anybody is unwell, I think we need to continue with that. I think before one kid would get a cold, everybody gets a cold, right? And we just accepted it as normal. And I think now, with the stricter protocols on keeping children home if they have a fever, I think that's important to keep up. And if you notice your child doesn't, have allergies or asthma, but they are sniffly and they have a runny nose, like those are things that we just need to pay attention to and normalize staying home when you are not well.
Yeah, that's a good point. Angelique, actually, listen, you saying that, and you talked about a lot of really good resources at the beginning. And, I kind of think we went quickly on that. Can you kind of just one more time kind of explain to parents where they can find the resources that you have mentioned a couple times about which licensed providers are open and all of that? We're going to put it in the chat box, but I just think that that's important to state again.
Yes, so for both families and providers that are looking for information about how to, families are looking for information to find licensed child cares, greatstarttoquality.org. And then there is also information in there that you can find directed towards families enrolling or starting, or even if they're already in childcare, but that they go under families and greatstarttoquality.org and go to childcare during COVID-19. And there's a cute story in there talking about how my school fights a virus, and it has factual information about how like the school will change and everything, and the precautions they have to take. And it just has factual information for the whole family, for children and the parents, so everybody can feel at ease going back to school, going back to childcare. And again, that's greatstarttoquality.org. And you can specifically click on families. And there's lots of information also about questions you can ask a childcare provider in there. If you're a new parent or just a concerned parent, there's so many resources under there that are helpful for both families and childcare providers if you are just looking for more information for your program or for your families.
Great, thanks. I like ending always on a positive note, and we have about 7 more minutes. So if each of you could just state probably one thing that you think is your best advice to give to a parent in order to get them to feel confident in enrolling or returning to a licensed childcare center or home, what would that be?
I-
Dr. Andy.
I'd be happy to start. So, I've, as the kind of the volunteer American Academy of Pediatrics early childhood champion, I've had an opportunity to work with early learning and childcare providers for the past decade. And I would say that, working with this childcare group, they are very, pro health, they're pro child. They want to do what's best for the children. And I think it's been brought up before, childcare providers are really used to dealing with a unique population. They've had to deal with lots of infections in childcare. So they are used to this. And they were really one of the quick adapters to this pandemic. And so I feel like they have really made a safe environment for children. We know they play a key role in providing development. We know the role that, isolation and it's played on, this pandemic has played on children. I see it all the time in the emergency department. So I feel as, for parents, I'm very confident in the childcare system here in Michigan. They are working hard to make sure it's a safe environment. And we have data to show that. I run a surveillance network in my county of, multiple childcare centers, and the COVID rates have been exceedingly low. It's unbelievable. And it's because childcare providers have been seriously and systematically putting the things that work in place. And so they have an excellent track record. So moving forward, I think as parents need to return to work, you need to go back to school. I think they can be very confident that they're going back to a safe, environmentally nurturing environment. And that's what I would say.
Thanks. Dr. Swindle?
Well, it's really hard to add much to that except to say, I think we all agree that children are our most precious resource, and that everyone on this webinar feels that way and acts that way in what they do. Children are amazingly resilient and adaptable. And so I feel like the transition back to childcare from the child point of view is doable and safe. And then I know I've said it before, but I do think having the COVID vaccine available is a game changer as well.
Monique?
Yes. So, yes, Dr. Andy, you did an awesome job with that recap. And Dr. Swindle, you're right. Vaccinations are imperative, especially in these times. I just like to tell parents, be transparent and trust your parental instinct. You can vaccinate, you can do all the safety protocols, wear masks, 6 feet, wash hands. But if your gut is telling you different, do different. However, we are prepared, we are ecstatic, and we are eager to get you all back in our classrooms. We want to work at 100% too. Come back.
Angelique?
Yeah, I think something important for the families to remember is that if you're positive, your children will also have a positive outlook. So, prepare the whole family. Let them know, first they will meet the provider, and then let them know that in 3 sleeps, you're going to start going to school, and, giving the child a little bit of control as well. So they don't feel like, oh, this is happening to me. Like, let them pick out their mask or which t-shirt they want to wear, but let it be a limited choice, with this red shirt or the blue shirt, to not overwhelm them. But yes, the providers are already, they are excited to receive your children. They are waiting. I talk to providers every single day, and they tell me, like, what can I do? Like, we've done all the things we need to do, to be ready to have new children, but they're just not coming. So they are waiting for your call. So please, find the child care provider, the program that works for you, the education program that works for your family, and see what fits your needs. There is a program out there to fit everyone's needs, and they are excited to hear from you.
Thank you. I like that you mentioned picking out your kids' clothes or having them pick out their clothes. I would love for you to come to my house in the morning and help my daughter pick out her clothes, because that is literally my hardest time of the day. It's awful. It's awful. No matter what. She's a lot of work. But anyways, I want to thank all of you today, Dr. Andy, Dr. Swindle, Monique, Angelique. I think that this was a really good. I hope all the parents that are on got their questions answered. I want to thank our hosts, the Michigan Women's Commission, the Early Childhood Investment Corporation, and Zero to Thrive Michigan Medicine. If any of you that are still on, if you missed some of this webinar, or if you know of a parent that is family, friends that weren't able to join us today, you can see this webinar probably in the next week or so on any of our hosts' websites, including the Michigan Women's Commission. If you follow us on Facebook, Twitter, or Instagram, we will be putting up when the webinar is available. So I just want to wish you all a great weekend and all a very confident and successful transition that is back to our new normal. So thank you, everyone.
Thank you.